All right, we are on air.
Thank you very much, Hannah. My name is Barbara Sattler. I'm a board member of the Alliance of Nurses for Healthy Environments. I'm going to be being a bit of a host here. We have two really exciting and wonderful speakers for you. I'd like to just start by introducing the topic of how we as nurses follow the evidence and practice in an evidence-based way, which sometimes means advocating based on the evidence. And we have two topics today that ANNE, meaning the Alliance Nurses for Healthy Environments, hasn't really covered before. And one of them is about fluoridation in drinking water. And we have Azita Amiri, who is an associate professor. She's also a nurse and nurse midwife. She's at the University of Alabama in Huntsville in the School of Nursing. She has co-chaired the research committee of the Alliance of Nurses for Healthy Environments. She's currently a board member. And she is a fantastic researcher and has done original research in indoor air quality. And while she was a co-chair of the research committee, I asked her if she and the committee would review some of the latest research on fluoridation. And what she discovered is there's really emerging research in this area, and felt that nurses should know this, especially because sometimes we get asked questions about this. So I think you're going to be very interested in hearing about this new research. Our second speaker, Catherine Dodd, is a PhD nurse as well, and she has held a number of very high-level positions in policy and in organizations, including being the executive director of the California Nurses Association years ago. But she also has really worked in the legislative and regulatory policy arena. She was the staff person, the district in Congresswoman Pelosi's office, and she's also just held a number of positions, high-level positions in the administration in San Francisco. So she comes with a science background as well as a policy background, and both are going to be very important in the topic that she is going to be presenting, which is radio frequency radiation, and talking about cell towers and cellular technology and cell phones. Both of them will be specifically talking about perinatal and early childhood exposures, which is the theme of this 4-part series that we've held. We may actually have some more parts coming up as well. We thank you all for being here today. And let's get started with Azita. I'm just thrilled that you're going to be presenting this, Azita. So thank you very much. You're on.
Sure. Good afternoon, everyone, and thank you so much, Barbara, for such a great introduction about me. Yes, this topic is very interesting and also sometimes I would say heartbreaking, and it shows how much we don't know about 75 years of public practice and how much we sometimes intentionally or unintentionally ignore the science behind a practice that we are doing forever. So it's gonna be kind of an eye-opener for everyone. It was the same for me. I didn't know anything about this topic until I got involved and then read more and more and more, and then I was shocked. But anyway, next slide, please. So a little bit of the history of sodium fluoride. That's the bag of sodium fluoride that goes to our water distribution centers in our utilities, and then it is marked as a poison, toxic, and as you see, it says that the target organs are heart, kidney, bones, the nervous system, GI tract, and also teeth. So this one, it goes to our water. They dilute it. That's why how they support their action, that it is getting diluted really very, very low level. So it shouldn't be any problem to people to drink the water that has this toxic material. But anyway, it started in 1945, and this past January of 2020, actually was the 75th anniversary of the public practice of public water fluoridation. And then it goes back and forth, a little bit discussion on 1950, and then in 1950, the American Dental Association, they endorsed it, and then American Medical Association endorses it. But all those endorses, you will see in a little while when I'm talking about the background literature on this, you will see that they don't really endorse it based on the strong evidence. And then anyway, in 1950, they practically started working on that. And it's almost all over the nation. Some counties have been really strongly opposing that, adding fluoride to water, which I wish that I was living in one of these counties. But in my county, they added, and they get a lot of support from CDC, endorsement from CDC, awards from CDC for being such a good follower of their public health practice. Next slide. So as you see, out of 195 countries, there are only a few of them that adds fluoride in their water. And here we have listed only a few of them, but there are 27 countries out of 195 that adds fluoride to their water as a public practice. And Europe also, like before 1990, they used to add fluoride to their water, but then they noticed the adverse health effects of that, and they stopped it. The only European country I think that is still going on a little bit in 50% of the population, it's England. That is the one that adds fluoride to 50% of water in the entire country. And I think that's because of the low level of natural fluoride in their water. So fluoride is also coming to the water naturally. That is a natural fluoride, but the sodium fluoride that they are adding, it has several other contaminants like heavy metals and some acids that adds to our water, and we drink it every day. Next slide. So there are several other sources of fluoride beside water that we drink. Like you all know that we have fluoridated toothpaste, we have mouthwash, and also the glue that they use for dentures. And some medicine has fluoride in them, like this is the inhalation anesthetic gas that they use to put you in sleep before surgery has a lot of fluoride. And that fluoride goes and works through the brain system and knock you down so that you can tolerate the pain for surgery. And also tea that we drink has lots of fluoride. Juices, beverages have fluoride, and mostly that is because they use the public water to make these beverages. So that makes sense that we see fluoride in like Coke, sodas, or fruit juices. And also the meat that we use, specifically the ones that is being cut and arranged for you in the stores, because during the processing and cutting those, they cut the bone, and bone has a lot of fluoride, and then the meat gets contaminated with the meat that they sell. I really don't have time to buy the whole chicken and clean it up myself. But since I have read these things, I've said, okay, no matter, I can sleep 30 minutes or an hour late and start working on these things and cut my own chicken. Next slide. So this is from EPA. As you see, it belongs to 2010. And they have also mentioned the sources of fluoride for human consumption, which is water, and this amount is different based on our age groups. And we get some from food, we get some from beverages, toothpaste, and also pesticides. The company that makes fluoride and pesticides is the same. So pesticide has or does contain fluoride, and it is sodium fluoride originally was used. It was in 1930s. I don't know. I'm not that old, but some of you might have read about it, and you will see that it was originally used to kill rat and cockroaches at home. So they were adding powder in their houses that contained sodium fluoride to be able to kill those rodents. Next slide, please. Okay, so most people assume that adding fluoride to public drinking water supplies is a safe and effective way to prevent tooth decay, and this is what's going on in several of our public organizations, like CDC endorses that, and we will go through that really quickly in a couple of slides, and then American Dental Association, a huge supporter of that. ANA, and I will show you their website, and APHA, they all support this public health practice, which again is about 75 years old. Next slide, please. Okay, as you see, this is CDC website, and I just printed it, just take a screenshot of it, last night. And they updated in January of 2020, and I see it's a little blurry here, but you will see that it says many research studies have proven the safety and benefits of fluoride. Next slide, please. But when you go to that page, doesn't have any citations. But when you go to another page underneath water fluoridation basics, you will see this other. You will see their citation, and then unfortunately, it's not really clear here, but they are all belong to several years ago, and one of them actually is for 1950s or 1964, and they have not included any of the research articles that came out within the past 5 years in regard to neurotoxicity effect of fluoride in children and fetuses. So that's really unfortunate. This has been updated in January of 2020, and before that, they had so many resources that could have been cited here and could have been given some warning about the potential neurotoxicity of the fluoride, but they have not mentioned it here. Next slide, please. So this is ANA website, and they also support, and they are saying that the most current evidence shows no harm of using fluoride in public water or drinking fluoride. Next slide. So, and this is EPA, and they have listed here chemicals with substantial evidence of developmental neurotoxicity, and fluoride is one of them. Next slide. And here is in 1965, Dr. James Sumner says everybody knows fluorine and fluorides are very poisonous substances, and we use them in enzyme chemistry to poison enzymes, those vital agents in the body. So as we see, it's been clear since 1965, like about 5-10 years after they started putting fluoride in our water. Next slide, please. So I published an editorial in June of 2020 about where the water fluoridation and when current research contradicts public practices. In this article, I have focused on 3 different sections or topics of this public practice. One is on safety, the other one is effectiveness, and one is ethical consideration. That I want to go through that here with a focus on pregnant women and also infants and children. Next slide, please. So looking at the safety first, next slide. So in 2016, the National Research Council they published this book. That's a book. And they mentioned that the studies of the potential neurotoxicity of fluoride exposure lacked sufficient detail and did not allow definitive conclusions. And in this book, they not only mentioned the neurotoxicity effect of fluoride, but also they looked at thyroid dysfunction. It seems like thyroid needs to get iodine, but when there is no iodine available, or something is more than iodine, concentration of something is more than iodine in the body, then thyroid going to grab another element. And the closest element in our body to iodine is actually fluoride. And if you look at the Mendeleev table, you will see that they are listed on the same column, which means that they are very close chemical structure-wise. And then they also mentioned endocrine disruption, which the studies have shown that in places that we have high water fluoridation, we see girls getting mature and come to puberty and start menstruation earlier than the places that they have not had water in fluoride in their water. They are also mentioning about lowering IQ and also its effect on GI, renal, hepatic, and immune system effects, and also it's been known as a carcinogen. Next slide, please. So that was in 2016, and one of the actually panel members said that the report should be a wake-up call. So they had a red flag in 2016. But despite this uncertainty, they still encouraged, like Alabama, and they give them money and they give them award for being such a good consumer of fluoride and adding in the public water. Next slide. Okay, and then here we have in 2019, so more research came out, more focus on neurotoxicity effect of fluoride. And then they mentioned that fluoride is presumed to be a cognitive neurodevelopmental hazard to humans. And this conclusion is based on a consistent pattern of findings in human studies across several different populations, showing that higher fluoride exposure is associated with decreased IQ or other cognitive impairments in children. Next slide, please. And then they are coming up with, and those are all from that report came out, and they are showing that there are several studies that they have found very low risk of bias. So those are the high quality studies, and 20 of them were selected. And as you see, all the studies except one of them found significant adverse effects, but some of them found that there are adverse effect exposure for fluoride level of 0.7 milligram per liter water. In water, they add 0.7 milligram per liter. That's their limit. That's their threshold. And the other studies found that adverse effects is related to higher level of fluoride in water. And that's where the controversy is coming, and probably CDC and EPA and other public organizations are focusing that, okay, we are adding only 0.7 milligram of fluoride in the water. The studies shows that if there is more than 0.7, then we see the adverse effect. But honestly, you all saw the different resources, the different sources of fluoride. We get some from water, we get some from pesticide, we even probably getting some from the air. Can you calculate how much have you gotten it every day? No, we cannot calculate it. Even if you tell me that the water only has 0.7 milligram per liter, but how about the other sources that I'm getting fluoride from? Next slide, please. And here, as you see, the 60 of the studies are focused on IQ in children. Next slide. So anyway, in March of 2020, the National Academies Press, they reviewed the previous report that came out in 2020, and they said that the committee does not find that NTP has adequately supported its conclusion. That finding does not mean that the conclusion is incorrect. Rather, further analysis or a reanalysis, as noted in the present report, is needed to support conclusions in the monograph. So seriously, how far can we go with our evidence to be able to convince you that there might be some potential health effects. So here is really, we're coming short as scientists that, so in human studies, whatever we do, we're not going to get to absolute conclusion, right? Because there is always confoundings. There is always the different levels. There is genetic that is coming in and confounding our studies. So shouldn't we really focus on precautionary approach and say that there might be, because those studies showing that. Next slide, please. And then we had several studies, older studies, that were showing the neurotoxicity effect of fluoride in children, specifically IQ. Next slide. And within the recent years, like this one was published in JAMA, Association between Maternal Fluoride Exposure During Pregnancy and IQ Scores in Offspring in Canada. And the findings indicate the possible need to reduce fluoride intake during pregnancy. Next slide. So they've measured fluoride through different ways in the urine and water, and also the entire consumption of fluoride. Next slide. And then they saw that per 1 unit increase in fluoride exposure, we will lose 5 IQ points in children. That's huge. If you have a score of 100, you are a normal person sitting there listening to the lectures that you're getting from your teacher. If you are 95, you are one of the ones who are not going to be able to understand what they are saying. Next slide. So before publishing that article, this is what the editor says, that decision to publish a study on maternal fluoride exposure during pregnancy wasn't really easy. That was something against the public practice, and talking something that contradicts what we are practicing for 75 years wasn't really easy. And he says that when I saw it first, it was like, the thing that came to my mind was, what the heck? So there is a podcast for that. If you want to just Google it, and you'll find that it's really interesting. And then there is an editorial written that this professor from Harvard saying that I would not recommend to any patient, any pregnant women, to take any tap water for drinking during the pregnancy. Next slide. Next slide. Okay, so that's the advice, that pregnant mothers shouldn't drink fluoridated water. Next, please. So then another study came out about the infant formula, and they found that those children who were formula fed and lived in fluoridated area had dramatically lower IQ compared to those who lived in non-fluoridated area. Next slide, please. And then it comes to fluoride and ADHD, and I'm not going to go through these. You can read, but there are also strong evidence showing fluoride is associated with ADHD, and they find it in places that have higher fluoride in their water. Next slide. So the medical advice here from those articles that don't mix formula with fluorinated water. Next. So how about the effectiveness? Next, please. So it says that fluoride effectiveness is mainly topical. So the evidence shows that if you brush your teeth with fluoridated toothpaste, then yes, might be. You might keep your teeth out of decay. And the average cavity rate is only 2.1 for 6 to 7 years old. And then based on the CDC's calculation, by adding fluoride to public water, we are only saving 0.5 cavity per child. Is fluoridation really effective? That's the question for all of you to think about it. Next, please. So, and you see that this is a graph that shows that we don't really see a lot of differences between teeth cavity in places that have added fluoride in their water and those that haven't. Next, please. And I will skip this one because of the time. Next, please. And this is, I don't know how many of you know Dr. Lamphere. He is a pediatrician working in Canada, and he's saying that by allowing children to be exposed to toxins or chemicals with unknown toxicity, we are unwittingly using our children as part of a massive experiment. Next, please. Okay, hypothetical considerations. Next, please. So fluoride, as you saw, is in medicine as well. And so it's a medicine being added to public water without our consent. And they haven't given us a choice. When we go and buy like salt, we can buy iodinated side or non-iodinated side, right? Or any other minerals that are added to the any of the foods or salts or some other things. But we don't have that choice for fluoride. Why? What is the thing behind this that we have to all use that? And it's like how the question is, how can one size fits all and fix the tooth cavity problem for everyone the same way? So that's really an ethical issue. Even if water fluoridation was 2 or 3 times as effective, it would not justify damaging children's brain for life and causing numerous other health risks. Give us a choice and let us know, like CDC, we expect CDC to put all this information there so we decide if we want to be use or consume water with fluoridated or non-fluoridated. Next, please. And then as you see in the toothpaste, they have a label that this is keep out of reach of children under 6 years of age. If you accidentally swallow more than used for brushing, get medical help or contact poison control center immediately. So if I drink a lot of water that has fluoride, should I really contact the poison control center immediately? So this is a really huge controversies between what they are saying and what they are doing. Next, please. And then you'll see that they are selling water for infants that has fluoride in it. And I just picked it up last night from Amazon, and this is the mouthwash for kids that has fluoride as well. So if you put it in the market, people are going to buy it. Okay, so someone should be held responsible for that, for this, to take these out of the market. Next, please. And there is also a website in the EPA, USDA, that it shows that we have fluoride in everything now, like rice, cereal, and as I said, meat, frozen foods, and everything else. And there is a link that doesn't show, but you can go and look at that list. Next, please. Okay, so the precautionary principle. We have a lot of evidence now. Shouldn't we take an action here and do something? Or even if you don't have enough evidence, let's say that our evidences are all wrong, they are all biased. So what? Shouldn't we still think of that maybe there is something wrong with adding fluoride to water? That's why we are getting some of these evidence showing us the relationship or harm. So the precautionary approach or principle really should work in this matter, but for some reason it does not. Next slide. Okay, there is a link here that's a really good documentary. Not that you should believe all of them. Those are all, sometimes, not all, but sometimes there are pieces that have bias in it. But other than that, that's a really 1 hour and 38 minutes documentary that's worth to watch. Thank you so much.
Azita, thank you so much for taking this on in the capacity as a co-chair for Annie, and then writing about it and bringing it to the forefront. And I'm hoping that we'll have a little bit of time to talk among those who are on the webinar with us here. It was a very provocative, wonderful talk, and thanks for presenting the evidence. And now we're going to move quickly to Catherine Dodd, who is going to be talking about another topic with evidence that most nurses don't know about either. So if Sarah, if you'll pull up Catherine's slides. And Catherine, thank you so much for being with us. And she's another person who got pulled into a topical area that was not her area of expertise, and has spent over a year now really delving into the research, and also working with people around the country and around the world that are trying to better understand the science here and its implications. Catherine, thank you so much for being with us. Go ahead now.
So can you hear me?
Yes, we can.
Great. Thank you, Barb. And Azita, so many of your points overlap with what we find in wireless radiation, the NTP study, that we are all a massive experiment without our consent, and the importance of the precautionary principle. So I'll touch on those as I go through. Today, we're going to talk about wireless radiation exposure in children, and I could easily make this an hour-long talk or even longer, but in the interest of covering ground, I've not added references to the slides, but all the statistics and findings I report are from peer-reviewed scientific journals and studies. I give much of my credit to the Environmental Health Trust, ehtrust.org, and to Physicians for Safe Technology. And they have slides in my presentation, so you'll see their logo. I also want to thank Dr. Karen Duderstadt for putting this series together, and the Annie staff who've made it happen. For those of you who want more information, you can please email me at catherine.dodd@gmail, and I can send you the draft chapter that I've submitted for publication in Annie's online text of environmental health. So next. Everywhere, kids are playing with, doing homework on, and watching devices. Most device manufacturers have hidden the fine print that cell phones should be at least an inch away from your ear or your body, and tablets and laptops should be 8 inches away from your body. Next, if we look at a history of cell phones, the first ones were introduced in the 1980s without any pre-market testing on health effects. And that really continues today. Recommendations were made by the FDA advisory committees prior to the 1996 Telecommunications Act, but were not taken into consideration when the act was passed and when the SAR guidelines were developed for cell phone safety. Next slide. Now, the SAR guidelines stand for specific absorption rate, and they're done on a mannequin designed to mimic a 220-pound man whose ear is exposed for 6 minutes to see if the temperature inside his gel-filled head, that's a mannequin, raises over 1 degree per centigrade per kilogram. No biologists or researchers were involved in setting this standard. The FCC received demands from Congress and medical experts over the last 20 years to reconsider the standard. And in fact, in 2019, they did open it up for comments on changing the standard. They received over 1,000 comments, including comments from Annie, and chose not to change the standard. Next slide. So in terms of cell phone basics, you hear about 1G, 2G, 3G, 4G, and 5G. Well, the G stands for generation. So it's a generation of technology. And as I mentioned, we saw in the 1980s, the first generation. In the 1990s, we had digital and voice and text with 2 generations. And then beginning in 2000, we had 3G, which allowed us to browse the internet. And 4G, which most of us have now, or a combination of 3 and 4G, allows us to download videos. 5G really is about the machines and the IoT, or the Internet of Things. When the 1996 Telecommunications Act was passed, we were using 2G phones. 3G phones maxed out at a frequency of 900 megahertz. And much of the research that I'm quoting deals with 3G phones because we haven't had 4G long enough to do longitudinal research. The Internet of Things is going to refer to our smart houses, our cars, artificial intelligence, and Siri. So we'll talk a little bit more about that. Next slide. The this is all about the electromagnetic spectrum and the non-ionizing versus ionizing part of the spectrum. On the left is non-ionizing. Non-ionizing uses microwaves, and the FCC telecom industry suggests that it's harmless because it doesn't have thermal effects. Now, most wireless devices, as I said, use 900 megahertz to 3 gigahertz. And the FCC's recently approved using parts of the spectrum that are 6 gigahertz. And as you get closer to that little sun on the picture, you see that the frequencies get closer together. They're shorter and closer together. Our laptops and our computers and wireless devices usually use 2.4 gigahertz, but they go into the terahertz or millimeter waves. And fifth generation technology uses those millimeter waves. And because the waves are so small, they get blocked by things. They can be blocked by foliage. They can be blocked by a wall. And so you don't just need 5G to download things quickly. You need 4G to back it up. Now, 4G, you can have an antenna every half mile because the waves are longer. But 5G, with those short waves, you need an antenna every 500 feet. So what we're doing is we're adding on a 5G antenna and a 4G antenna every 500 feet. Next slide. Now, just a moment more about the difference between non-ionizing versus ionizing. Non-ionizing means it's not strong enough to knock an electron off a molecule. Ionizing means the electron can be knocked off, and it'll create an imbalance or an ionization of the molecule. Now, non-ionizing may not be able to knock the electron off, but it can add energy and it can heat things up. How many of you have had your cell phone or your laptop heat up while you're using it? It can also change signals, and it changes cell signals and penetrates cell membranes. Next slide. So as we look at antennas, you see the top macro tower on the left. If you're standing on the ground, you're fairly far away from that macro tower, although we've seen effects as close as 300 feet from a macro tower. The light pole is next, and then there's a fake macro tower that's called a unipole pine tree. So they're beginning to hide these macro towers that have multiple antennas on them in water towers and pine trees, behind signs. You don't know where you're being exposed. So again, we are being exposed without our consent. As you get farther away, the radiation decreases. But if you're looking at that right side and you're on the second floor of that house, you might have an antenna right next to your window. So just because many people say, oh, well, you're really far away from it. Well, you might not be if you're in the second story of a building. So next slide. 5G is the goal of it is to become active phased array. So on the left here, you see a blanket of 4G. It goes out from that tower and it reaches all those devices. With 5G, they actually want to send a beam to each device. Again, you're going to need 4G as well as 5G. And because 5G has shorter waves, you're going to need those towers closer and closer. And the 4G has greater penetration into the body than the 5G. Next slide. Early on, electrohypersensitivity was identified with people who lived within 300 feet of an antenna or with people who had a smart meter installed near their bedroom. Now people are experiencing it when they're in places with many cellular devices. And some of the symptoms include headache, lack of concentration, memory loss, irritability, depression, insomnia, fatigue, loss of libido, nausea, and lack of appetite. And we thought those were just from the COVID fear or the COVID uncertainty. They're actually symptoms of electrohypersensitivity that shouldn't be disregarded. There's an ICD-10 diagnosis code for it, and it's recognized as a disability by the United States. So next slide. So non-iodizing wireless devices send microwaves two directions. So the top one is a cell phone that is communicating with a cell tower. The next one is a laptop that's communicating with a modem. The next one is a wireless phone. I've had wireless phones forever, but that wireless phone is communicating with its base, which is an antenna that communicates with a cell tower. So you actually have an antenna in your house if you have a wireless phone. The one below that is a baby monitor that's communicating with someplace that you see the monitor. Headphones, earbuds, all of these are sending microwaves at any given time. Next slide. So, as I said, wireless radiation is everywhere. Cell phones, smartphones. Smartphones have 4 different radios and 4 different antennas on each device. Then there's Bluetooth and the internet, iPads, Kindles, laptops, smart readers, wireless computer networks, wireless headphones, infant toys, and now even diapers. There are wireless diapers that alert through the baby monitor that the baby's diaper needs to be changed. Wearables, glasses, watches. I used to wear a Fitbit, but I don't anymore. So we are surrounded by wireless, and all of those waves are penetrating us and are cumulative. So why is this important for children? And that's because of the things you've heard in the previous 4 talks that we've put on, that Annie has put on, and that's because children are more vulnerable. They have rapid cell growth and cell division. There are critical windows of vulnerability, especially for girls in terms of being exposure. But in terms of microwaves, it's exposure to the human brain and to the neurological system. And because they're exposed for a longer life. So I may have only been exposed to a wireless phone since 1980, but a kid born today is exposed to all those devices from conception to birth. So we're talking about toxics, pesticides, cleaning products, air pollutions, flame retardants, solvents, and non-iodizing radiation. All of these cause oxidative stress, which is associated with mitochondrial damage and over time with inflammation and cancer, with Alzheimer's disease, and with metabolic diseases like type 2 diabetes. Next slide. So the mechanism of action for wireless is that oxidative stress. And in 93 of 100 studies, they demonstrated DNA damage, lipid peroxidation, stress protein response, and again, antioxidant reverse effects. And right now, we need all the antioxidants we can get given the midst of the pandemic we're in. Next slide. So in a recent 2011 International Agency for Research on Cancer, IARC, it's part of the WHO, report suggested that EMF exposures can be more devastating in children because their brain tissue is more conductive. Their skull is thinner. Their smaller brains are softer and allow radiation to penetrate. And they're potentially exposed for longer periods of time. So the risk increases directly related to the age of the child, and it's up to 20 times that of an adult. Next slide. This is a 3D model of how deep the radiation goes. And it shows you in this infant that the hottest part is near the ear where the phone is, but it goes all the way across the face and across the frontal lobe of the brain. Next slide. This is looking down on the modeling, and it's looking at the specific absorption rate, how much temperature is increasing using a 3G phone. We don't have these models done yet for 4G phones. And it's important to note that in 2017, 50% of all 8-year-olds had cell phones. And by age 12, 75% of them had cell phones. Now, many countries have banned cell phones for children under age 16. Ours has not. Next slide. So I mentioned wireless radiation is a neurotoxin, and it increases the permeability of the blood-brain barrier. This causes loss of brain cells in the hippocampus, which affects our memory, neuronal damage in the cortex and the basal ganglia, oxidative stress causing headaches, sleep disturbances, and fatigue. It disturbs our nervous system, and because of the blood-brain permeability, blood-brain barrier permeability, it leaks albumin, but it also allows any toxins that are in our blood to enter our blood-brain cerebral fluid. Next slide. There has been much research recently about the parallels between autism and EMR exposure, and between Alzheimer's and EMR exposure. There are a lot of similarities. There's a scientist, a tech guy in Silicon Valley, Peter Sullivan, who had 2 children who had autism. And he thought maybe this has to do with EMR. So he blocked all the EMRs in his house. He protected his kids, and their autism resolved. So that's caused a lot more funding to look at that. The other thing that we know that EMR, electromagnetic radiation, does is it causes a trip of the voltage-gated calcium channels. So those are implicated in autism as well as in heart disease. Next slide. So here we have it, kids on their laptops. Next slide. Now, if you look at a radiation, this is from the Environmental Health Trust, a radiation simulation, you can see that that laptop radiation goes down the front of their chest, penetrates slightly into their body, et cetera, et cetera. Now, put that on a chair of a child whose body is primarily water, whose organs aren't formed, and remember that the small print saying how far you're supposed to keep it away from your body is very difficult to find on these devices. Next slide. So going back to our public health exposure concept, firsthand smoke is smoking a cigarette. Well, firsthand radiation exposure is holding that phone or device up to your body. Secondhand smoke is being in the room with someone else who's smoking. And if you look at the lower picture, it's being in the room with a parent who's using his device. And this one, the kids are also using devices as well. And third hand is being in a smoky place or having an antenna outside your building. Next slide. The risks to reproductions have been documented, and there are lots of research studies, but we know that there's sperm damage to motility and to their DNA. There's ovarian damage, embryo damage, and Dr. Den-Kun Lee from Kaiser Northern California Research did impressive research on close to 1,000 women, showing that the highest levels of everyday electromagnetic radiation exposure gave a 3-fold increase in miscarriage. So it's a serious problem. This is a picture of a cell phone it's a simulation of a cell phone in a pocket, and points to the sperm damage, which has been documented in several studies. So those electromagnetic exposures, Dr. Den-Kun Lee also looked at what was the risk for the offspring if fetuses are exposed in utero. And the longitudinal research shows increased obesity, increased asthma, and increased ADHD. Next slide. The radio frequency exposures in schools are significant. There's outside exposures of antennas, and then there's inside exposures from the slide device to the fire alarm, to all the kids using devices. Now, kids are at home now, so they're experiencing that at home, but wireless printers, wireless phones, etc. Next slide. So more screen time in kids results in more stress to the nervous system. Dr. Victoria Dunkley, who's a psychiatrist and a researcher and author of Reset Your Child's Brain, says that any device with an electric screen acts like a stimulant. It's a central nervous system irritant, and it emits electromagnetic radiation. It raises stress hormones, and it creates a physiological mismatch for high arousal, but sedentary action. So the implications are serious for children. Next slide. There's also an important issue of the toxic effect of blue light. Now, this is research from the French Agency for Food and Environmental and Occupational Safety, and they say that children's eyes don't develop the filters for blue lights that protect the retina until they get older. So this chronic exposure puts them at risk for macular degeneration, as well as the exposure to the retina deregulates biological rhythms and sleep. Next slide. So here we are with teenagers looking at their cell phones with an entire family, each with a different wireless product. Next slide. Dr. Nicholas Cardanis, who's an addiction specialist, points out, he wrote the book Glow Kids. He points out that screens are stimulated dopaminergic effect, and it stimulates the brain's pleasure center. Video games increase dopamine, and video imaging studies have shown gray matter shrinkage or loss of tissue volume from internet and gaming addicts. Next slide. So this new eye generation, this is from May 2009. It was a 60 Minutes episode, says that we spent 4.5 hours, this is in 2009, 4.5 hours a day on their phones. And they check their social media every 15 minutes. I think it's actually more often today. Next slide. They also, 60 Minutes, did reported on an NIH study that showed the thinning of the brain cortex in kids who use screens for 7 hours a day. 2009. Next slide. We know that cell phones cause memory loss in teenagers. There's several studies, but the next slide shows a 2-year study that's not just a cell phone, it's a cell tower. And that picture up in the left-hand corner is a water tower. And in that water tower is an antenna. It's camouflaged. And we saw kids with higher exposure with delayed fine motor and gross motor skills and less working memory and attention. Next slide. So our early history was that we found out there was an auditory effect from microwaves in 1962. And the US Navy recognized effects in 1971 and published them. It was called microwave disease. The Bio Initiative, which is www.bioinitiative.org, has more than 2,000 studies that show adverse biological and health effects just from exposure. Yet our country and many other countries only consider the heating effects. Next slide. I put this in just because I wanted to prove that I'm not just making this up. It was 2011 when the World Health Organization classified EMR as a carcinogen, a class 2B carcinogen. Next slide. In 2018, we completed a 10-year study of the National Toxicology Program, which verified that and said there's clear evidence that it causes cancer, but it's been downplayed by the FCC and the FDA. Next slide. There's a 5G international appeal by scientists from 41 countries asking the UN to put the brakes on further wireless radiation. Next slide. Many countries have implemented limits, and in our own country, the American Academy of Pediatrics and the Cleveland Clinic have made statements about wireless radiations. In Oregon, they passed legislation creating a commission, and just recently, this November, New Hampshire passed a similar legislation. It's important to note that in the United States, the Maryland State Children's Environmental Health and Next slide, sorry. The Environmental Health and Protection Advisory Council has urged that educational institutions hardwire their devices for schools. And I wanted just to point out that Dr. Barbara Sattler was key in creating the legislation that created that, and we need one in every state. So that precautionary principle that was mentioned by Azita, the 2009 President's Cancer Panel, essentially said that we need to use a precautionary approach when we look at wireless radiation as an environmental contaminant. We don't need to prove harm before we eliminate exposure. So here's a resource for pregnant women. It's called the Baby Safe Project. You can Google it. Next slide. I'm looking at a different screen, so I hope you're on the pink Baby Safe slide. And then just in terms of safety, power off your cell phones. Don't keep them in your bedroom. Power off laptop computers and game consoles at night or whenever you're not using them. Avoid using wireless devices in cars and trains. Use corded headphones, preferably air tube headphones, and keep devices away from children. If kids are studying at home, download the material, have them do their homework, and then turn the Wi-Fi back on and send it back in. The rest of the time, you should use airplane mode and keep the Wi-Fi off. Next slide. So get a corded landline for your home. Make your home a sleep sanctuary. Don't have any wireless toys next to that little girl's head. Switch from a smart meter, which sends out radiation constantly, to an analog meter. Most states will allow that. Next slide. Ethernet connections for computers. This is a cheap way to wire your computer at home. You can even wire your cell phones, and you can get instructions from the Environmental Health Trust on that. Next slide. Use a corded mouse. Even I have used a corded mouse, and I found that I have much less carpal tunnel syndrome using a corded mouse than a wireless mouse. Next slide. So what are the feds doing? Well, the FCC is appointed by politicians, including the president. They are influenced by the huge telecom industry, and they don't allow local governance over cell tower placement. So we know that there's compelling action and evidence for policy action. The best thing that we could do is do fiber optic wired into the premises. It's a perfect time to do it with the upcoming stimulus money. It's a shovel-ready project to put people to work. It's safe, it's fast, it's private, it's reliable, it's public. It will eliminate the digital divide, and it's very high quality. Individually, we have to walk our talk. We have to get wired. But we're so used and so accustomed to our wireless devices, it's going to be hard. And we have to expect pushback from the powerful wireless industry. Next slide. This is the last slide. So the tobacco industry told us that cigarette smoking was safe. The building industry told us leaded paint was safe. The beverage industry told us sugary beverages were safe. The pesticide industry told us pesticides are safe. The cosmetic industry told us the chemicals in personal care products are safe. The fluoride industry tells us that fluoride is safe. And we must insist that things be tested for safety. So stay safe, and thanks for your attention. How's that? That's it.
Thank you. Thank you so much to both of you. And I think you've all got our hair on fire for a variety of reasons. We also are not going to have time today for a robust conversation. But I think what this is a first foray into these two exciting topical areas. I think that we should be exploring them jointly through the Alliance of Nurses for Healthy Environments Research Committee and Policy and Advocacy Committee, so that we can have really robust conversations about this moving forward. Today, we had presentations of some of the science. It was impossible for either of the presenters to give us the full picture. There's at least one notation in the chat by somebody who would like an opportunity to talk more about this and present some additional science. We're looking to really uncover what the evidence is and how best to express that evidence in our nursing practice, which includes our practice at advocating for our individual pays and broader than that as well in terms of planetary health. So I want to thank everybody. And we had a great group today.
Barb,
Yes.
I forgot something really important, and that is that wireless radiation causes a significant demand on energy and contributes to climate change because all of those towers are electric. So our climate change committee should be including this in their climate change agenda.
Absolutely, absolutely. And so for those of you who would like to directly respond to Azita, and we'd be happy for us to know who is interested in this, her email address is aa003@uah.edu. I'll give you that again, aa033@uah.edu. And for Catherine Dodd, we'd love to know also if you're interested in this issue area, because we're interested in creating more robust conversations around these two very interesting areas. And Catherine's email is Catherine, spelled CATHERINE Dodd, DODD, at gmail.com. I'll give you that again, THERINE at gmail.com. And so thank you all for joining us. I'm sorry we went a couple of minutes over. I'm very excited to hear from you and to have you emailing these great speakers. And we will be doing continued conversations in the Alliance of Nurses for Healthy Environments on these two really important topics. And with that, we will see you hopefully for the next Maternal Child Health Environmental Health webinar series. Take good care now. Bye-bye.